So, good morning, still. Gives me great pleasure to introduce Louise Ballou, who's a psychiatrist, psychotherapist, clinical supervisor, and university lecturer in Toronto.
True.
She specializes in psychotherapy for creatives. Mm-hmm. Okay. Her private practice in Toronto offers individual psychotherapy to musicians, producers, and other creative professionals, creatives. She also offers psychological care to artists and musicians at professional creative retreats and songwriting camps. She teaches psychodynamic psychotherapy to psychiatry residents, that's in literature.
A lot of P's.
At the University of Toronto, where she holds an academic appointment as an adjunct clinical lecturer. She also works as locum physician in Thunder Bay, Ontario, providing emergency and inpatient psychiatric care to remote communities in Northern Ontario and supervising medical trainees and the Northern Ontario School of Medicine. The reason I invited Louise, because a friend of mine, Brandon, started this podcast called Beauty at Work, interesting title, and he told me, while he was telling me about the podcast, you've got to listen to this doctor on this Beauty at Work. Okay, so I took his advice and listened to this doctor. That doctor was Louise. And I was so amazed by in Louise's, the way she spoke and what she said about the way she is with her patients. And she'll tell you more what she does. She's working in addiction. What is it called? The center in Toronto? The addiction.
Yeah, CAMH, Center for Addiction and Mental Health.
Center for Addiction and Mental Health in Toronto. Talking about how the patients would come in when they were intoxicated, and she would wait for their real self, or their I, to come out, to be discovered. Never heard a psychiatrist speak that way. Never saw a psychiatrist smile.
Touché.
So we spoke, and here we are. So Louise, tell about and most importantly, she had the inspiration for the title of the theme of this MedConference. She wrote me and said, "Why don't we talk about creativity in medicine?" Creativity in medicine. That's unusual. So indeed, we were so fascinated by this idea that we made it to the theme of the whole MedConference, and I think we're going to hear more about it.
Wonderful. Thank you so much. Thank you. So thank you all for being here. I know we're at the very end, but I appreciate everyone sticking around. So these morning's talks were really, I think, feeding beautifully into what I'll be talking about today, but I hope this kind of captures the theme of the last few days and thinking about our practice. And we have a mixed practice. We have some doctors and nurses and allied health and different people in medicine. So when I use the term medicine, I won't use healer and I won't use provider, but if I say medicine, I feel whatever we mean about helping people. So today we'll be talking about my practice very briefly, how I bring creativity into my work, these ideas of recess versus classroom mode. How can we be creative in medicine, and how do you find your own kind of recess, this idea of play and freedom within medicine? And then hopefully some time for Q&A. We may not, but I love my favorite thing, and I love to teach. My favorite thing is to have a discussion. I know it's trickier with a lot of people, but I hope we have some time. And honestly, if anything comes up at any point and you want to just jump in, please do raise your hand, or that's my preference, is to have this be, as much as we can, be a discussion. Okay, does anyone recognize this photo? Have you seen this photo before? No. What's that? Dali, yes, you got it. So this is from Time Life. When I was a kid, so my father is here. Actually, my whole family's here. It's wonderful. So they're all doctors. My dad's a family doctor, and sister and mom are doctors as well. So yes, runs in the family. And so we had this Time Life book. I grew up in northern Quebec in Val-d'Or, lots of time on our hands, pre-internet days. So we would read books over and over again. We had this amazing Time Life book with all these, like, the best photographs. And this photo came up. And it's a very strange photo. So it is Dali, taken by a photographer called Philip Halsman. And so he was American, and he took these portraits around. His main period was the 40s to sort of 60s and 70s. He invented this thing called jumpology. which sounds like psychology. And his idea was, how can we capture the real essence of a person? And he invented this technique where he would ask them to jump. And the idea is that when you jump, you can't be posed. You have to be in a state of surprise and spontaneity by definition. Unless you, as you will see, there are some exceptions. If you jump for a living or if you move your body for a living, you can be a little bit more controlled. But if I were to jump right now and you took a photo of me, it would capture a different side of me than I am right now in this posed psychiatrist, although I do smile even with my patients, but kind of controlled way. So this photograph actually took 28 tries to get right because it had to all align perfectly. And so this is also an idea I want to talk about today, the balance between control and planning and spontaneity and accident. And that's medicine, right? We do our best, we follow our protocols and our strategies that we talked about this morning, and then you have to allow and in fact embrace a certain amount of chaos. And also I think this captures the emergency room where I spend a lot of time. So if anyone works in the emerge, this is like, or maybe pediatrics, or maybe parenting. I have 2 young kids as well, so this is reflective of that. And we have some young parents in the audience as well. So these are a few examples of some false starts. So there was an assistant holding the chair up on the side there. The easel was strung by a thread. There was some post-production work where he painted in that middle painting. Notice it's different here. So he fit that in, and the water wasn't quite right. So you try your best, you plan, and then you let go, and you see what happens. And so that's hard. And I think as a physician, it's really hard. And as a psychiatrist, to your point, Mark, we are taught to be very controlled and very non-spontaneous. Sometimes with my residents, I try to unlearn this with them, but we are often feeling it's dangerous for them to see us. If they know who I am, I must not be a good doctor, right? And this is an old idea, but as we talked about this morning, if your patients don't feel like you're a real person, how on earth can you help them, right? How can they trust you? How can they actually open up enough to be in a relationship with you? And psychiatry, to me, is the relationship, right? My job is the art of the relationship with a patient. Because yeah, we have medications. They're not great, as most of you probably know. And so what do I have? I have myself. I have who I am as a person. But like this example, it's going to be a mix of control and chaos. So anyone recognize who this is? Audrey Hepburn, yes. And you recognize this one? Liberace, well done. Well done. So he was someone who's fairly histrionic, perhaps at baseline, and the jump psychology tests, pretty intense as well, but spontaneous. To me, this suggests this is who he really is inside, right? This is a dancer. Sorry? No, Edward Vieira. I'm actually not familiar with him. I don't know if anyone knows him. But you can see it's a bit more posed. So this is an example, again, of someone who uses their body for a living. So he was actually able to control his face, his entire body. Again, beautiful photograph, this echo, the V. So a little bit less spontaneous in that way, but still revealing of who he is. So we talked about this briefly, but in my practice, I work as a psychiatrist. I work in the emergency room up in Thunder Bay. I do inpatient work up there as well. And then I have a psychotherapy practice. And initially I had a very mixed practice. I worked with young people, sort of young transitional age and young adults. I think I liked a little bit of that surprise and chaos there too. And then I was invited by a friend of mine who is a massage therapist to provide therapy at a musician's retreat, a songwriting retreat. And I was like, okay, sure, let's give this a try. And for me, it was profound. It was like, talk about sort of falling in love with your work. And I was like, these are my people. This is the world that aligns beautifully with who I am. And this idea of who you are and who your patients are, and that it matters that not everyone is going to be a good fit for you. That if you are neutral and standard, then you're probably bad for no one, but not that great for anyone either. And so I think there's a spectrum of how flexible you can be, but in this work I realized that this is where I can be both creative and use all my background, skill that comes from my clinical work. So, and I also made me think a lot about creativity and how this, what we'll be talking about, how this came to be. So, anyone have seen this TED Talk? Yes. Amazing, yes. So this is Jill Bolte Taylor, who's a neuroscientist, American neuroscientist, and she had a stroke, a major left hemisphere stroke that she was aware of as it was happening. And of course, she was noticing and paying attention to the deficits that were coming as her left hemisphere went offline and her right hemisphere came to dominance. And what she revealed, and she wrote a book, and she wrote a few more books about that, about our modern understanding of the left and right hemisphere is actually different than maybe what you've heard. You know, left is like logic and language, and right is like artistic and creative, right? This is like the sort of colloquial way. Are you right-brained or left-brained? The reality, of course, is that we are all both, but we are two people. We are two different selves, our left brain and our right brain. This is Ian McGilchrist. This is a bit more inside baseball, a psychiatrist. Anyone read this book? Yes. Did you like it?
I have some reservations about some of them. I'm a neuroscientist.
Oh, okay. Oh my. Okay.
What I appreciate the skill of decision science and it says is willingness to contextualize them with broader tools, not blown in psychological reflection.
So there's a perfect example. So I'm coming in with, and I would love to hear your thoughts. I'm coming in with a theory and idea that I have. I'm not saying this is the truth. I'm not saying this is fact. And if you disagree, you know, either you're right or I'm right, right? This is about creating and understanding something through the discussion of it. And I think that there's such value, and we have some experts in this field and many people experts in different fields. And again, to me, getting closer to the truth, wherever that is about collaborating together and holding that truth lightly, right? So your left and right brain, you are two people. You have this corpus callosum, which is the bridge between your two hemispheres. What's very interesting is that that bridge is inhibitory. Is that correct? Yes. Mostly. Perfect. Yes, exactly. There's no, cut and dried, no one truth. Mostly inhibitory. So the idea is that if you are actively using both hemispheres, truly, then that is essentially a seizure, right? It's overactivity in both sides. And so it's a little bit like one foot on the gas and one foot on the brake. You can't press both at the same time, you're not going to go anywhere. So are you more on the brake or on the gas? And there's different ways to think about the left and right hemisphere. You can think about sort of childhood or adulthood or the id. This is old school, Freud. So the right being more the id and spontaneous and your needs, and the left being more control and superego. But I came up with this idea of classroom and recess, which is very appropriate because this is feeling, more classroom style. But I also very much appreciate everyone engaging and laughing and talking and paying attention, because I want this to have an element of recess, that you guys are not just sitting in your tidy little rows, paying attention, all uniform, which is the classroom mode. And in our medical training, we are taught to be excellent students. And most of us in this room started out, for all kinds of reasons, including myself, as very good students, right? We know how to fit in and conform and figure out what someone else wants from us, and to put ourselves into their little box to be the best sort of little standard unit to fit in with the whole system. So this is left brain. The left brain is about fitting in. It's about order, so language and math and structure. And how do you control your universe? How do you focus on the present moment? Not what's possible, not dualities or theories. It's really about, let's look at the present moment and decide if it's A or B, right? Right or wrong. Is it the right answer or the wrong answer? The interesting thing about classroom ideas, and including in our medical training, is that within that world, you think that is reality, right? Did you get a 90% on the test? Do you know the right answer? We're trained in medicine, we do 2 years of didactic teaching. And then you go into your clerkship and you're like, oh, the real world is very different than what I learned in the classroom. But within that world is this delusional idea, right? It's the left brain, it's a bit delusional, that it believes that it knows the truth. And if you just follow the rules, if you just do what is expected, you will be safe. And this is a very important part of the left brain as well, is it's where anxiety and danger signals live in the left brain. It's about what happened in the past and what will happen in the future, and how can you prevent danger through doing the right thing, answering correctly, fitting in, not being an outsider or an outlier or rejected, right? So you fit in. It's safe, it's not unique to you, but that's what happens. You grow up and you go to school and you go on to your training and you get a job and you stay in this mode. Most people stay in this mode most of their career. But, so this is an adventure playground. Has anyone seen this before? Seen the movie 7 Up? This is the 7 Up series. Anyway, it's the 1950s. It's pretty wild to think about this today. But this is sort of some British-style playgrounds they had. Not too much safety. But so this is your right brain. Your right brain doesn't care about safety and what might happen if I fall, or will I break my leg, will I get tetanus from this rusty nail? No. It's just like, wow, let's go. Yes, and, right? Curiosity. What do I want in this moment? So there's that aspect of play and adventure. There's also this piece of connection, right? Social. You decide. There's no set seating, right? You decide who you want to hang out with. Maybe you want to be alone. Maybe you want to be with certain friends. Maybe you shift between groups. So socially, again, it's much more fluid, and it's much more guided by your own kind of what you want. What do you want at this moment? There's a piece about physical movement too, which is the right hemisphere, moving your body, being in nature, in the physical space, in the actual reality. So the real world, this is, Jill Bolte-Taylor talks about this, the real world is much closer, in fact, to your right brain experience than to your left brain. And people who have hemispheric strokes where they become left brain dominant, so their right brain goes offline, they struggle, right? They struggle to see the real world because they have this false idea. But we all have the delusion, and in medicine and in the system we have the delusion that this is reality, right? Now, this is perhaps a more extreme version of reality, I'll give you that. But real life and real medicine is probably closer to this, a little bit chaotic, a bit unpredictable. So in medicine, you have protocols and diagnostic criteria. This idea of cookbook medicine, right? You do A, B, C, D, E. And sometimes that works with the right patient in the right time. And if you're in a rush, absolutely, you can protocol your patients. You worry about what's going to happen, so you do defensive medicine. Oh, I don't know if I'll discharge this patient yet, because what if something bad happens? So I'll keep them an extra 24 hours on a form. So I will withhold their ability to go out and live their life because I don't want to take on medical legal risk on me, right? So I need to be aware of that because you want to balance that risk. And some people are very risk intolerant, some people are more tolerant of risk, but it's not a simple answer, right? You can't always do the safest thing for you. That's rarely the best thing for your patient. So the right brain, this is where we think about your own curiosity. When a patient says something and I'm like, oh, I wonder what you meant by that. Or if my patient is talking about beauty, my patient's wearing or reading a book sometimes on the inpatient unit, I'm like, oh, tell me about your book. That seems interesting. And it's an opening to something different. And they will tell me different things because I'm just genuinely following what I care about. Now, I can't spend my whole day doing that, but if I can loosen up a little bit of my checklist of things I have to do, that will provide better patient care. And most importantly, perhaps, I will be able to be rewarded by my work, right? I won't be completely drained from trying to be a little automaton in a machine. So there aren't as many examples of this. Maybe differential diagnosis, we think about what are possible things, but it's harder to think of this, right? Like if you actually think about your practice in medicine, how often are you truly in your right brain mode? Like 5% of the time, 10%, right? So what's measurable is what's valuable. This is what we're taught, right? Lab values, and when I discharge a patient, I get a pat in the back, right? If I can see 10 patients today, that is a win according to the system. Doesn't matter the quality of the care, actually, but it's the number. And I know RVUs, I'm not an American physician, but I understand that's the same kind of thing, right? The standards. So if I want you to start thinking about your practice. How often, again, are you in this unstructured kind of mental space where you're guided by what you want, what you're interested in, where you feel freedom? So freedom is an important piece too. I think about this with my residents, that so much of your training is you're trapped, right? Someone else decides you go to this clinic at this time. You don't know who your staff is going to be. You don't know what you're doing day by day. And then you graduate, and then you're supposed to somehow remember that you have agency and freedom? No, right? So people go on to train, to work where they trained, and to just kind of fit into someone else's path. That often happens. And rarely leads to people who are meaningfully rewarded by their work, I find. So remember, again, you're two different people. And who are you? I can think of myself. Who am I when I'm in right brain mode versus left brain mode? I am two different people, right? And I'm trying to kind of walk that line today. I'm aware, time-wise, like how are we doing for time? Okay, I have to pay attention to that while I'm talking. But I also want to keep some lightness, right? I also want to keep some freedom. Anyone know who this is? She looks a little bit different than you might remember her. No, it looks like her a little bit. You might know here. This is Brigitte Bardot. Early Brigitte Bardot, before she went blonde. So I want to show these side by side because this is the same photographer, Philip Halston. On the left, you have her pose photo. This is the left hemisphere. This is where she knows she's being watched. She's working on her angles. She's sort of staring at the camera. It's not spontaneous. It's a part of her. And on the right, you have her free, right? And I think she's quite young in this photo as well. But it's very different. These are both sides of her. This is another photo. People have seen this one before? You got it? Yeah. Which is amazing. So this is, again, side by side. You have them carefully posed and then kind of loose. This is royalty, right? So it's rare to have this. I don't think that this would fly today. I don't think the court would be okay with that. And another example here. People recognize her?
Ma'am. What do you say?
Grace Kelly. So totally different, right? Totally different. If I go back here again, but notice compared to this other photo, say, she is more controlled. She's not as big, right? And I think that's her true personality. It's a little bit of a Rorschach perhaps, but this is still who she is. And I think you see it here. The range of her affect, if I can use a psychiatric term, is not as broad as maybe mine is or some other people's are. But these are two sides of who she is, so the left and the right. Another great example. I don't know if you can see. Nixon. This is Nixon. What a contrast. So, I think he was always fairly serious, but you certainly see this boyish kind of quality when he is more in that right brain creative space, free, spontaneous space. So how can you be creative in medicine? You want to balance, right? You can't all be in the right brain. You can't all be in the left brain. How can you switch between both sides? And we talk a lot in psychiatry about dialectics. This is the word people are familiar with. So dialectical ideas, meaning two truths that are opposing. So how can two opposite things be true at the same time, right? Your left brain doesn't like it. Your right brain is cool with that. But your left brain is like, how can my life be the most important thing that I can possibly imagine and be absolutely meaningless, right? Like we are meaningless, and yet we are the most important thing. My daughter is, my world, but in 1,000 years, it won't matter. And to people who have never met her, there is no meaning. So how can I hold those ideas in mind, right? It's uncomfortable, but it's also liberating. And in psychiatry, we talk about this with personality disorders. Certain people really struggle to say, I hate someone, but I love them. And I can't do that. I can't do both. But of course, I'm sure we've all hated and loved people in close succession, perhaps even our patients at times, or people that we love that are very close to us. So it's about switching ideas and being flexible on how we can jump between both the hemispheres. So in psychotherapy, we talk about informed spontaneity, which is this idea of structured thinking, but also spontaneous. This is a dialectical idea. How can it be informed by my experience, by protocols, by diagnostic criteria from the DSM, which are arbitrary in and of themselves, but they matter because it's our language, right? It's a language that we all speak. Can you take something seriously, but also hold it lightly? Also say, this is my, tentative diagnosis, and if I hear something different, I will adjust. My ego, which is again left side, can my ego be sort of confident enough and strong enough to be challenged and to say, well, maybe I was wrong? And then we talk about rupture and repair, which is this idea that relationships are fluid. And sometimes with patients, I will say the wrong thing, my face will flash the wrong emotion, and they will be upset, and they will be hurt, and they will be angry at me. And can I trust that I can come back from that I can repair the relationship, that I can stick around long enough to actually repair what I ruptured? And to do that, you have to trust that you can take a bit of chances. You can kind of color a little bit outside the lines, because otherwise, if you don't trust that you can repair, then you will never take a chance, right? You will never deviate. This is like new medical students, as new learners, they stick to their protocols, and they are robotic, and they are not therapeutic because they're scared of what will happen if they actually let go, right? They don't trust. So this piece about safety is very important. Can you feel safe enough to go in that right brain? Can you trust that the danger, which your left brain is very good at analyzing danger, can that danger signal be quieted long enough to say, okay, let's play, let's take a chance? And in medicine, it's hard to feel safe, right? And we are taught and we are hit over the head with you have one license and malpractice and you will get sued. If you take a chance, your patient will fall in love with you, or they will murder you if they know your home address. Like, we're constantly taught these things, right? Like, truly, it's outrageous. And yet, we are taught that. So can you kind of balance those risks? So how can we balance that idea of a realistic risk, which is a right brain, reality-based idea, versus an overblown binary, either I'm safe or I'm not, right? Because if you're looking for zero risk, this is the wrong field, right? It's just the wrong, and people enter medicine, I've known these people, and they loved science, and they loved structure and order, and then they came in and met human beings, and they were like, this is awful. And if they can't switch out of that mode, they become either honestly unsafe doctors, or they burn out, or they're certainly not providing good care. So I also, this is my other piece, I do again a lot of medical teaching, and I'm like, we should be teaching this idea to our learners before they enter the wards, because they go in thinking that they have a set plan. As long as I follow these steps, I will be safe, and then they can't. We are setting them up to fail, right? So can we manage risk, and can you, of course, over time, practice to see the realistic kind of risk? So imposter syndrome, I don't have time to go into this more today, but this is a topic that comes up a lot, in fact, with my musicians that I work with, who many of them are successful, they're touring, they have multiple albums, they're making a living in Canada from playing music. So you can just imagine how small a group that is. And doctors, same kind of thing. How many of us in our room today, about 100% of us at some point felt like, what am I doing here? Why was I given this burden, and there's no way I can live up to this expectation of me? And this is a left brain idea because, again, it's anxiety, it's a worry that I'm not going to say the right thing, and it's a fear in being vulnerably dangerous. If I'm real, I will get in trouble. And so we feel like imposters because we are imposters. If you live in your left brain, then you're ignoring half of who you are, right? So you're not really true to yourself. So that imposter feeling of like, I am not me, is an accurate signal of the reality of how you're being perceived by other people. But if you don't feel safe to show who you are, then you live your life as an imposter. And small anecdote, one of my musicians had this experience. He was telling me that he was touring, and after the show, he goes to sign autographs, and this fan of his shows him a tattoo she has of his lyrics from a previous song. And he had such an intense imposter syndrome in that moment of like, are my lyrics good enough to be permanently etched on your body? Like, he felt this responsibility of like, they were definitely not good enough. And you can just imagine spiraling. But if you had asked him 5 or 10 years ago, that you would have written a song that was good enough that a stranger would permanently, again, tattoo the words on your body. That would have been his dream. And it's an interesting, again, duality that we think, oh, we think we want to achieve these things, and then when we get them, our brain can spin it into a way that once again aligns with this fear and this danger of being seen and being real. So how do you get around imposter syndrome? I think it's about spending more time in recess. How can you shift into that mode more often and trust that you can be safe and welcomed? You can be part of a community while being real. You know who this is?
Campbell is.
There was a recent movie about him. That's it. Yes, though this is Oppenheimer. Oh, I didn't actually show the other side, but very revealing because he doesn't show his face, notice? And he's in a lab, which I'm sure that's not an accident. There's this dynamic movement, but also an intensity, and so I think it reveals elements of who he was. So the easy one, Marilyn. She looks very happy. She looks genuinely happy in this photo. It's not a posed happiness. This feels like a kid, you know? You know who this is? It's Eartha Kitt. Yeah. So beautiful, but again, a bit more controlled, a little bit more posed as well. So there's performative kind of element, but beautiful in this beautiful dynamic of her dress. Okay, so if you think about your practice, what are the times that you feel that you can get into recess mode? The times where you feel alive and free. Who are you with, right? Who are the people around you? What are you doing? Is it a certain kind of patient? Is it a certain kind of procedure? Is it a physical place? So when I went to Thunder Bay as a 5th-year resident, I met a nurse and a few staff psychiatrists, and within minutes, I was like, this is it. These are my people. And I've been going back for a week a month for 7 years now. And I've tried many, many other places, and nowhere has felt like home as Thunder Bay has, which is bizarre. But it's the people. For me, it's the people, something about that community and the nature of the work that just aligns with me. And so think about that in your life, right? And I was lucky, but I also was strategic. And I said, when I saw that, I said, you know what? This is valuable, and this is rare, and I'm gonna fit it in. So I live in Toronto, and I go to Thunder Bay, a week out of 4. It's, sounds crazy, but that works for me. And so to think about what are the creative ways that you can sort of listen to that intuition where you're like, this is for me, and to break out of the classroom. Because you have to make space for it. The classroom the system, we've talked about this yesterday, the system will always want you to be just a cog in the machine. The system doesn't want you to be unique and flexible. It's awful. That's slow and unpredictable, and you might get mad at your patients. This is no good, right? Not good for reviews and RVUs and all that stuff. So everything around you will tell you, don't take a chance, don't follow what you love, stick with the plan. And so just like in schools, recess is being cut out, and gym class is not recess, right? Gym class is like a mandatory pizza party for work, right? We all know. Or lunchtime yoga, but mandatory, right? That's not you. That's not what you want. You're just pretending to be in a recess mode. So you have to pay attention to what you want. It has to be unique to you, and no one else can build it for you. It has to come from within yourself. So again, musicians, and again, there's so many parallels between musicians and medical students and residents and doctors, which is surprising to me initially. But musicians are very much like people here. They're the ones who do this for a living, at least the ones that I've met, are highly intelligent, really hardworking, really determined, really diligent. The delay of gratification, 10 out of 10. And they do it for no money, remember. So even harder than for us. And so they have this issue too, because they start out and they have an album or they have a song that resonates with an audience, and then they have to release another album. And how are you going to do that? You can't just repeat what you did, because that's not going to resonate, maybe not with you or maybe not with other people. And you don't want to disappoint the fans who already had a conception of who you are. You have to reinvent yourself, but not too much. What's the expectation out there? What's the vibe? What's cool? What's not cool? Are you just going to be like a legacy band who just does greatest hits for 30 years, right? Which is left brain, you're going to make money. But are you going to be fulfilled? Are you going to be rewarded? Probably not. Maybe you can sort of eke out some pleasure out of that. But when you're the band and you're playing a song that your audience has never heard, that's hard, right? That's dangerous. And they may not like it. And so I don't blame the bands that stick to the standard model. But it's not a fulfilling and rewarding path. So, again, thinking about your lives, we won't have time to have a more fulsome discussion, but I hope today you can sort of go home and think about, in your professional life, in your personal life, what does recess look like? How does this feel? How much of your time is actually in that mode? And can you actually vote with your feet, right? Can you decide that if a place that you work at does not embrace you and insists on you fitting a box that you feel causes moral injury or is just really toxic to who you are, well, yeah, you can try to fight to change that system, and I think there's value to a certain extent in that. But also, when people tell you who they are, you should trust them, right? You should listen. And when the system says, we don't care about you as an individual, we want you to be a cog in our machine, well, they're telling you what they're looking for, and you get to decide, do I want to be that cog? And maybe you do, and that's okay. But to be honest about that, about what you're signing up for, and not just fighting endlessly against a machine that is going to grind you down. You can't, none of us as individuals have the strength as individuals. So you can either vote with your feet and change and go elsewhere, or you can start to build a little community, and you can be the agent of that to start to build something different with you and the people closest to you, because that's all you have power over, right? You can build a little moat or a little bubble that can sustain you, right? But again, if the organization won't even tolerate that, and again, I have other patients as well that I see who are burnt out and unhappy, and they go on repeated medical leaves, and you watch them do the same thing again and again and again, right? And so there's an element where you have to say, back to the talk yesterday with strengths-based nursing, let's do strengths-based medicine as practitioners. Let's see ourselves as strong and competent and agents of change, not passive, oh, well, whatever happens, we are going to have to tolerate it. Like this idea that patients are that way. We complain about that with our patients. Why don't you actually actively take a step in your life? Well, let's do that for ourselves, right? Which is hard, and I'm not saying it's easy, but to give you some hope that I think it's easier than you expect for the people, and I know many people here have already done this, but for the people who are struggling, that it's probably easier than you expect to at least take that first step. Because again, the classroom is safe, it's predictable, it's easy, if you go to the job and you know what you're going to be expected to do, it's easier than applying for a new job, figuring out a new EMR, figuring out a new team of who's going to be your charge nurse and what's the culture there. This is scary. I get it. Changing jobs and not even changing careers, just changing physical hospitals is stressful. So we stay in what's safe. And again, to be patient with ourselves. But what are we choosing to give up by accepting something that is not what we could do best? And when I think of creativity, it's all of us here have an absolutely unique voice. Is what you're saying. A unique voice that truly the world needs to hear. Your patients need you. You have a little bubble that you could create incredible things. I really believe that. And the system is never going to encourage that. And so I think that the loss, the reason I do the work that I do is that I see that potential, and I see how could we work together? Even my musicians, how can I work together to allow you to write that song, right? To make the album that all these people will hear and connect with deeply. That's my purpose. That's where I find meaning. And so all of you have your own version of that, where you find your deepest meaning. And everyone has that. That I actually absolutely believe. But some of us have more confidence that we can do it. So this idea of ikigai, I think people have heard of this before. So an ideal sort of career or reason for being, a bigger purpose, is these 4 factors. So these are the easy ones, what you're good at. So if you have good grades or what the system tells you you're good at, we tend to know what we're good at, not perfectly, but in general. What you can be paid for. Again, we're very lucky in medicine. overall, that we are paid for what we do. Again, lots of gratitude when I work with creatives who are often not very well paid for what they do, and they have the same passion that we all have, but there's very little money, but they still do it. And then what the world needs. So we're lucky. Most of us, that is a slam dunk. What we do is deeply needed. So that's great. Again, we're very lucky. But then the top one, who talks about that? What do you love? And again, I ask my patients, ask my residents, like, what do you want? What excites you? What are you interested in? What do you love in terms of your work? And other than choosing your residency sort of stream as a medical student, which is often done through how competitive is something, how prestigious is it, how long is a residency, do we actually ask ourselves the question, what are the elements of the work? How does that align with me? Let's test something out. Let's try it out and see if I enjoy it or not. So this is like a sort of a shorthand, sort of quick assessment. Is this recess or classroom? So if it's these things, you're in recess. So you're inefficient. You're not, and I love being efficient. I love like banging through the tasks. So I have to resist that urge to say, no, this is going to be intentionally inefficient, because that is the nature of that recess mode. It's not a hierarchy. It's not the doctor at the top who tells everyone else what to do, who's the expert, or the patient who's the expert of everything, or the administrator who's the expert. We're all equal, and we all have different strengths and different interests. Is it flexible? Is it surprising? Is it social? Like I feel the energy. Do you guys feel the energy here? Like it's different because we're all here. We're all paying attention, and most of us may never speak, and yet we can have this moment together. This is like magic. So this is a recess moment right now. Can you be vulnerable? Can you be human? Can you feel safe? This idea of beauty, I didn't go into that as much today, but a very interesting idea that things that are beauty, like a beautiful sunset or a beautiful lady with her, no dentures and her hair, flowing. When you're caught by beauty, when you're captured by it, that's your right brain kind of grasping you and like forcing you into the present moment. So pay attention to that. Where do you notice beauty? Where are you like taken aback? And that's a useful signal. So humor, another thing too, when things are funny, that's the right brain state. In your senses, is there movement? Are you in nature? This beautiful balcony here is a great example, again, of that recess space. And are you doing what you want? And do you know what you want? Which is a very hard question. Again, if I asked you all to sit with me for 10 minutes and tell me what you want, even just about your work, it's a hard thing. It's a hard thing to answer. So these are just brief examples from my work. How can I get into that right brain space? I follow my curiosity. This radical candor idea is also a psychiatric idea of like, can I just tell the truth? And I say, wow, this is, like with a patient in therapy, if we're not progressing, I'd say, wow, this is pretty frustrating. I feel like we're stuck. Like, wow, you tell your patient that you feel like you're stuck? Yeah, you do. And it's powerful. It's incredible what happens when you tell the truth. It's like unlocks everything. And they're like, we are stuck. Thank you for, acknowledging that. It's incredible. So can you kind of practice, and this is my resident supervision, I'm always kind of inching them on to and mostly validating and reinforcing when they allow themselves to be true with their patients. And you see it unlock this magic and care, and the patient gets better. This is the whole point. We don't do this. I mean, it's good to do it because you feel alive, but the real point is that it helps your patient. It helps your patient to see that you are a human being. So taking calculated risks and balancing what the system needs versus what the patient needs versus what I need. And I find we often forget what we need as clinicians. Like, I often don't take lunch, I work too late, I quadruple book my patients, or someone does it for me and I am too nervous to tell them that's too much. So can we balance all those needs? So other examples, non-clinically, going for a walk around the hospital. I don't know if anyone does that. Just go get some air. It's really hard because I have patients to see. How could I stop my workflow to go for a walk in the middle of the day? It's outrageous. I feel self-conscious sometimes. So someone's going to see me out the window and say, Dr. Ballou, she's not doing her work. There's people in the merge waiting. So how can I resist that, knowing that I return to my patients with life, with better care, and maybe it's only 10, 15 minutes, it's not ideal. An administrator probably would not like it, and they have great reasons. And so maybe I should go for a walk further away from the hospital windows. Like a radical, exactly. You got to be an agent of you got to find your own space. So, and you can do that too, right? We don't have to always fit in perfectly with what's expected of us. Sometimes I need a break and I'll just close the door. It's like, is that antisocial? Is that rude? I'm saying I don't want to talk to people. But sometimes I have talked to enough people. I need a pause. And so I will close that door. And that feels risky. But then I say, okay, well, let's try it out. Let's experiment and see if I feel better after 10 minutes of just settling my nervous system. And this is a big one too. When I'm in my office and I close the door, can I not pick up my phone and check my email or check the news? Because then I'm right back into the classroom mode. Then I'm right back into, what I should do and anxiety and sort of structure. So what can I do in that period instead of falling into all these temptations that are back to the system? So creativity is where you feel safe enough to go out on a limb. You can trust and rupture and repair, and you can know that, again, you're not alone in this. That is all the right brain. So in summary, everyone here, you are two people. I suspect very strongly that most of us are more in that classroom mode, especially in our work. And how can we balance that to allow our recessed self to live, to exist, because it is half of us. It's absolutely half of who we are. And can you feel safe to get in that space? You do have freedom. Again, that's a right brain idea. When you're in those desks, chained to the locked to the floor, bolted to the floor, you don't have freedom. But mostly, you do have freedom, or you can find pockets of freedom, and you have to fight for them. You have to be creative, but can you trust that they exist? Because no one else is going to do it for you. No one else will build that path that suits you. It has to come from you. And you have to know what you want. You have to take a leap of faith. And this is my little pun, because we're leaping, right? These are jumps. So can we jump? Can we leap like this? Do we know who this is? Nah, you got it. Beautiful, beautiful. This is a bit harder.
I'll begin that.
What's that? So Dorothy Kilgallen, she was a journalist and a TV show presenter. Beautiful photo, very, very controlled, right? Not someone who ever lets loose, even in her jump. And then, no, this is Lena Horne. Yeah. So I leave you with this. It's a beautiful quote from a Buddhist master, the first woman, a British woman who became a Zen master. And so she says, "My goal is not to lighten your load. It's to make the load so heavy that you'll put it down." I know. So I'm not here to say, oh yeah, it's not so bad. Again, a pizza lunch will make it all better. And let's just, better self-care, do yoga and go to bed earlier and you'll feel better. No, this is hard. This is so hard. So it's so hard that this deserves all of our attention. This is not an optional thing. If you want to work for 40 years, so I have to talk to my father here. How long have you been working, delivering babies? 44 years, right? He loves it. He loved it the first day. He loves his last delivery, probably last week. And that's how you stay invigorated and finding meaning in your work. And I hope to work 44 years. It's only been 7, so we're on our way. But I want to take this seriously, and I hope for all of you, no matter where you are in your career, to respect the challenge of finding this balance. And that's it. For all those years. Okay.
Well, I've never seen a psychiatrist like you. Questions? And I think I'll go out.
Hi, I'm wondering if you have seen any differences between male and female brain processing of left brain and right brain classroom elementaries.
Oh, that's a great question. I'll have to defer to our local neuroscientist. Do you have an answer?
I have not seen evidence of systematic discrimination as HB
Well, sorry. I'm by no means an expert in sex differences. I haven't seen any studies demonstrating that in the kinds of sort of creative work tasks that you're talking about. But we do tend to see volumetric and functional activity differences in many tasks, so I'm sure they're there. I don't know if they're being investigated or not. I imagine that they're there.
I have a suspicion, again, right brain theory, that parenting is also a mode that puts you into so much like mental load and tasks and loses, like you move away from that creative space. So I wonder if there's an age related thing to a pre or post parent. That's a curious, I don't know if that was ever studied, but I don't know. I do know left-handed people tend to have more balanced hemispheric activity versus right-handed people, which is always the opposite. Yeah. Yes.
Is there any sort of like coordination function that you could practice to engage your right brain more?
Yes. So there's this book, Drawing on the Right Side of the Brain. Have people heard of this book? So this is it might be a Columbia actually. There's an artist who a while back, maybe 30, 40 years ago, developed this technique where you use I believe you use your left hand to draw, which activates the right brain. There's all kinds of activities, but drawing on the right side of the brain is what it's called. You can Google it. There are others. There's things like mindfulness, theoretically helps get you gone in the moment, but not a ton of research, in fairness, to how to balance that out. I'm very interested in that field, actually.
There's something that struck me about your presentation and the other presentations this morning, is that the bridge between the left and the right, I think, lies in self-compassion.
Interesting.
And I'm wondering what you think about how to cultivate self-compassion and vulnerability that allows you to get to that other side.
Huh. It's very interesting. Well, to me, self-compassion is maybe the shift from that fear, judgment, rigidity of the left brain into patience and with yourself and loving. Like the right brain chooses this idea of love. Jill Bolte-Taylor gets more into this, but religion and spirituality and this idea of the universal whole, that's the right brain idea, right? That we're all connected, and that thing that scientists are like, you can either be rational or spiritual. It's like, no, you are both. We all have a sense of higher purpose. Why do we do the work that we do, right? Because there's a sense of that we think it's bigger than who we are. So I don't know exactly for self-compassion, but I suspect being in a right brain mode is the more you are in it, the stronger it gets, right? Anyway. Yeah, the neurons that fire together wire together, right? So the more you're in that space, the easier it is to go towards it. Yeah. Any other questions, thoughts? Just by this is for me. Show of hands, anyone feel like this may tip the scales in how you look at your work, or you look at your career, or how you make decisions for yourself? Okay, wonderful. And I succeeded. That was my goal today. So thank you. Okay, wonderful.
I couldn't help speaking up here. Her father. Her dad. I'm so proud of her. She mentioned something very quickly about cell phones. And I have a particular attitude about cell phones, and particularly about young people with cell phones. And it just become clear that cell phones put you in your left brain because you are being judged all the time. And you are always getting the news, and you are always being told how you should behave. And of course, everybody knows that when people are suffering from anxiety and depression, like never before in history. So there you go, that's my talk about that.
I love it. I bet you an intervention to this point to get into your right brain would probably be just avoiding screens for 24 hours, 36, this like the idea of the Sabbath, the digital Sabbath, or people take a full week without technology. I bet you that would build up your right brain. I haven't tried it personally, but I'm sure it'd be very good for me. It'd be very good, but one day. What's that?
You take 10 minutes and you're on.
Yeah, exactly. Wonderful. Okay, thank you so much.
I've been tasked to wrap up. I can't wrap up. Maybe I don't want to wrap up. This has been an amazing 2.5 days or whatever, 3 days, 1 evening and 1 morning and a day. Left brain. Every speaker has been amazing. Every speaker has been creative. Every speaker, in a sense, created a space for the unexpected and was unexpected. That's the most amazing thing to me, that there really was an amazing richness that was, in a sense, far beyond, and that way unforeseen, far beyond and far different than what we expected when we put this together. In all the many meetings that we were trying to put this together, this meeting far exceeded my expectation and the expectation of most of us who were putting this together. This is what we call, there's so many unexpected, unforeseen events that happened in the last few days. So there's no way to summarize any of this because it's much bigger, I think, and it's something to digest for the next while, hopefully for a while longer than the time it takes you to go home and check your cell phone. But there's this, in a sense, is a space for that unexpected, and that's what really struck me this weekend. We have been doing this for 15 years, and we hope to continue doing this, although some of us think it's too much work to do every year, but then we're told we should do it every year. And Elvira is telling us that. It's the guiding soul. And so we will hope to reconvene next year. We don't know where, maybe here again, and we'll let you know. There is a website, the MedConference.org, which is as original. I know, but if you write MedConference, you get there. I can't remember the AAMP.org, so there's a website. We will therefore keep you posted. There will be, we've taped, Jeremy, thank you, we've taped and recorded everything. Hope they won't be like the last time 2 years ago when it took me 2 years, i.e. still not up there. I'll try to do better this year and get it up on the website, on a YouTube channel perhaps. But I think, I've learned many things. I've been really moved by so many of all the speakers. Every speaker was exceptional, just like every patient is exceptional, and it's a matter of learning to see what is there, but we so often don't see. So on that note, I'd like to thank all the organizers. I'd like to thank all the speakers, all of you for staying here so numerous to the end, and I wish you a safe return home, and bon appétit for the lunch that is being served. In 10-15 minutes, so don't go there yet. They told me to keep away because they're just setting it up right now. So what awaits you is a terrace. Beauty at work. Thank you all.
Why is there a picture? Where is it?